BCEN test prep exam dumps. Question 1. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 2. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 3. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Hepatitis A is primarily transmitted via: Option A, blood and body fluids. Option B, fecal minus oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal minus oral route. Question 5. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 6. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval. Option B, peak T waves. Option C, ST depression. Option D, delta waves. The correct answer is option B, peak T waves. Question 7. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. Question 8. The most effective method to control severe bleeding from an extremity wound is: Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 10. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 11. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 12. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 13. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 14. A Call's fracture involves the option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Question 15. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 16. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. Question 17. A patient presents with cholinergic symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 18. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 20. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign. Option B, Cullen's sign. Option C, Murphy's sign. Option D, Rovsing's sign. The correct answer is option B, Cullen's sign. Question 21. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Question 22. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C is surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 23. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 24. The priority patient for a trauma team activation based on mechanism of injury is option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Question 25. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine.